Hi, I'm Dr. Samantha. I'm a naturopathic doctor that specializes in hormone health and fertility care. My patients know me as Dr. B, and I'm here to chat about unexplained infertility today. So welcome, we're gonna jump into the topic of unexplained infertility. Now, this is a diagnosis that I see many people receive after they've been to a reproductive endocrinologist, and basically they're told, we're not really sure what's going on, let's move to next steps such as IUI or IVF. And I'm here to share that I truly believe that unexplained infertility may be more of just, I hate to say it, but more of like a lazy form of medicine. So at the end of the day, unexplained infertility is just saying we don't have a diagnosis as to why you are struggling to conceive, right? That's the basis of it. And I always kind of feel bad saying it's lazy medicine because at the end of the day, I do believe every doctor, or not every doctor, but most doctors have good intentions behind what they do, and they really just don't know the root cause. However, that's when naturopathic medicine comes into play. I will tell you about, I would say like 70% of my practice is actually filled with unexplained infertility cases. This is something that I talk about, and it's one of the reasons why it's one of the first videos on my channel, because at the end of the day, it needs to be said that we can do something about these unexplained infertility diagnoses. For example, I really like to get to the root cause, like I already kind of just shared before. And what is the root cause? That means, what do we feel could be contributing to unexplained infertility? So let's get back to the basics. Unexplained infertility, like I said, is really prominent in my practice, but out of all cases of fertility, it's usually about 10 to 15% throughout that whole population. So that impacts quite a few people. So what's going to be the difference between a standard evaluation for fertility and a naturopathic evaluation of fertility? A standard evaluation will include confirmation of ovulation, an ultrasound, an HSG, an AFC, and hopefully also evaluation of some additional hormonal labs. The difference between a standard evaluation and a naturopathic or more holistic evaluation, we are going to take a thorough intake of signs and symptoms. So in the fertility world, a lot of the times people aren't asked how are they feeling. They pretty much just check basic labs and then say either things are yay or nay. That doesn't always cover it, right? If someone has an irregular cycle but has normal labs, do we really think that everything's still okay? What I like to really dive into in my visits at least is what could be the root cause. For example, if I have a case where they have been told they have unexplained infertility, but they have irregular bowel movements, really terrible cramps during their cycle, and severe acne. I'm totally just kind of making up the symptoms here, so just bear with me. To me, that is not unexplained. To me, that there's very clear reasons of something going on here. We just have to figure out what it is. I'm thinking about hormone health. I'm looking at optimal versus normal values. When it comes to hormone health, I'm thinking about gut health. You know, what is going on in the GI system? Why are we having irregular bowel movements? And I'm also thinking about, what are other things that could be playing into that, such as thyroid health or your immune system, that could be having additional effects on just even how your hormones are presenting. Even something as simple as your stress levels. So check for hormonal imbalance and then also rule out structural imbalance. I myself specifically don't do the structural or anatomical things, but usually those who go to a more conventional doc or pair conventional and naturopathic medicine together, that's usually taken care of. So as we kind of talked about in the previous video, conventional medicine versus naturopathic medicine, they're usually going to be going to IUI or IVF as next treatments, specifically for unexplained infertility, because at the end of the day, they're not quite sure what's going on. But, what about the underlying cause? If we don't know what's wrong and we don't know what's going on and we're jumping to IUI and IVF as methods for treatment, what do we expect is going to happen that's different, right? If we jump to IUI or IVF first, how do we know that the root cause is being taken care of? For some people, maybe it is, right? There are very valid reasons to do IUI or IVF, but at the end of the day, a lot of times root causes are missed, right? Like I said, did we check for thyroid antibodies? Did we check the gut health? Did we make sure there's no autoimmune reactions? Did we make sure that everything is best taken care of? You know, there's no low vitamin D, no low iron. Like, I feel like I could go on and on about all of the possible explanations. At the end of the day, I work with many people who use conventional medicine as well as naturopathic medicine to, you know, find the best combination they can for their fertility journey. I believe that they can be really powerful together, and that's been said before in previous videos. But when it comes to the unexplained infertility piece, I highly encourage both partners to be treated individually and together, because one, it does take two. In the unexplained infertility field, it could be a lot of little things just adding up. So there's not one obvious reason as to why people are struggling or why you maybe is struggling with unexplained infertility, but there could be multiple reasons. On the female side, it could be there's elevated thyroid antibodies and progesterone is kind of low. And on the male side, it could be that there is a low motility or morphology count. And those things together are causing it to be really difficult to conceive, either naturally with IUI or with IVF. A lot of people who come to me with unexplained infertility have usually been kind of pushed down that route. So in reality, a lot of them have actually already done many rounds of IUI or IVF. When it comes down to it, they're not successful because they hadn't treated that root cause. And that's something that's so important. And I know I've said it like 10 times throughout this video, root cause, root cause, root cause. But at the end of the day, root cause is going to matter, right? It does make a difference, and making sure that we actually have addressed that is going to be so important. I am going to do a part 2 for unexplained infertility. Please don't hesitate to comment any questions that you may have. Hopefully I can answer them for you. I also do have an unexplained infertility masterclass that goes into really great detail about different possible diagnosis for unexplained infertility, and then it even goes into possible treatment options as well. So I will also have that in the description below. And then wait for my unexplained infertility video part 2. I'm so excited to share with you. Don't forget to hit the subscribe button, and I hope you have a beautiful day.